CAISS Thorax Exam. Question 1. What divides the right and left ventricle of the heart? Aortic valve, mitral valve, intracardiac septum, pulmonary vein. Intracardiac septum divides the right and left ventricle of the heart. Question 2. In medical terminology, what does hema mean? Air, water, tissue, blood. Hema means blood. Question 3. What is the term for when air is in the bloodstream? Pneumothorax, air embolus, hemothorax, aneurysm. Air embolus. Question 4. In medical terminology, what does pneumo mean? Blood, tissue, air, bone. Pneumo means air. Question 5. Where is the mediastinum located? Below the diaphragm, between the lungs, inside the cranium, within the abdominal cavity. The mediastinum is located between the lungs. Question 6. When using AIS coding for ribs, are right ribs coded separately from left ribs? Yes, they are always coded separately. No, they should be coded as an anatomical structure, unless there is flail on one side and non-flail on the other. Only if there are more than 3 fractures. Yes, but only in pediatric patients. No, should be coded as an anatomical structure, unless there is flail on one side and non-flail on the other. Question 7. What is a persistent air leak? A leak that seals itself within 12 hours. An air leak that lasts more than 48 hours. Injury is more severe than a pneumothorax. An air leak caused strictly by a ventilator. A minor leak that requires no intervention. It is an air leak that lasts more than 48 hours. Injury is more severe than a pneumothorax. Question 8. What is another name for the intercardiac septum? Intraventricular septum, atrioventricular node, sinoatrial node, mitral septum. Intraventricular septum. Question 9. How is a degloving injury coded in the thorax? Coded as an abrasion, coded as a contusion, coded as a laceration, coded as an avulsion. Coded as an avulsion. Question 10. How is an injury to the intracardiac chordae tendineae coded? As a severity 2 injury, as a severity 3 injury. Severity 5 includes the papillary muscle injury, as a severity 6 non-survivable injury. Severity 5 includes the papillary muscle injury. Question 11. How much blood loss indicates greater than 20% volume loss? 500 cubic centimeters for the majority of adults. 1,000 cubic centimeters for majority. For peds and individuals with smaller blood volumes use 20%. 2,000 cubic centimeters for all patients. 100 cubic centimeters for adults and 50 cubic centimeters for pediatrics. 1,000 cubic centimeters for majority. For peds and individuals with smaller blood volumes use 20%. Question 12. How is a thoracic injury not further specified, NFS, coded? Code as a severity 1, code as a severity 5. Thoracic cavity injury, code to severity 9. Do not code it. Thoracic cavity injury, code to severity 9. Question 13. How is a traumatic pneumatocele coded? As a primary chest wall injury, as a cardiovascular injury. It is a sequela resulting from a pulmonary injury, so it is not coded as a primary injury. Code it under the diaphragm chapter. It is a sequela resulting from a pulmonary injury.